You can go ahead and start. All right. Hi, I'm Dr. Steve Goeddeke, Accel Chiropractic. This is Jill today we have with us. And Jill is about 10 visits in with us, 10 or 11 visits.
About 4 weeks.
So you're actually getting pretty close to your first full recheck.
Okay.
But we're just going to do some demonstration, talk about her adjustment today, and we'll go over just a couple of details. You came in with us initially for problems with your knee.
Yep, I could hardly get out of the car and couldn't go up and down stairs with my left knee. It was so much pain. And so just in that amount of time, I've been able to go up and down the stairs without pain and get out of the car easily and stand up, because I thought maybe something was seriously wrong, and we were able to correct it.
Yeah, and you were also saying that your overall mobility was just less than you wanted it to be.
Yep.
Have you been noticing a little bit of a difference with that too?
Yeah, mobility is better, and strength. I feel like I'm just more centered and stronger up down the core.
Yeah. Another thing you said, your neck was stiff. And I know we found a lot of problems initially with your neck, which might have been a bigger issue than you realized at the time, right?
Yeah, because I never had my neck worked on before, and so this was a new experience.
Yeah, and you've been to a chiropractor. You actually spoke very highly of him when you came in.
Yeah, I thought that when I came in, I was self-diagnosed that that it was all lower back, and it turns out it was not. It was all in the neck, which thanks to you, to fix that.
Okay, so we'll go ahead and move to our adjustment now. We'll just highlight some of the major things we found. So I'm going to move around to the back of you here, Jill. So one of the big things we found on our exam was this arm. We would test it out here, and if you hold that, wow, that's already much stronger, and that's gradually sort of improved little by little. We also found this one was weak, right here, hold that. And that one, after the first visit or two, that didn't have any issues. We've been finding that weakness, and this is also leading to issues in the lower back. But when we have that weakness in the arm, hold there, tells us that things aren't connecting very well between the brain and the body, and the brain and all these muscles that coordinate those fine-tuned shoulder movements. So that's all of your rotator cuff muscles, these bigger movement muscles. If they don't connect well, you get weakness in the body. So what we've been working on for this is we've been checking the neck, and we go through here and we feel the movement. And the last few visits, we've been really working on that lower neck on the right side, getting pretty deep adjustments, which we probably couldn't have done the first couple of adjustments, but we've been able to work into that slowly where it's more comfortable for you. So let's go ahead and show how we do that adjustment. So we're going to bring your head over this way. And what was our key word? Surrender. Yeah. So drop all the way down here and lower that shoulder down a little bit more. Look up with your eyes. Okay. Good. And now it's just a tiny, tiny little pop. That was a lot of noise the first couple times we did that. And then we'll drop over this way and lower that shoulder down. Look up with your eyes. Okay, good. That wasn't bad at all. So now we'll go to face down. Now, that neck issue, beyond causing issues with the arms and the weakness there, it was also causing this leg to be significantly weak too. So now if we raise this leg up and you hold this strong, see, I can't budge you an inch there, so that's improved dramatically. The other big finding, if we bring your leg up like this and we push it out this way, initially, where was that bothering you at?
In the knee.
In the knee. Yep, now it's very connected to that symptom you were having. So nothing there now, which is beautiful. So now, all we're doing is getting nitpicky. We're restoring a little bit more movement to the places that need it. So we come in and we feel the movement of the spine, and you can feel that tightness right about there. Okay, I'm going to lift your hips up a little bit here, Jill. That puts the spine into a little more extension. Allows this adjustment to be easier. Take a deep breath in, let it all the way out. Now breathe in, hold it in as deep as you can, raise your head up off the table. Good. And relax, let it out. Okay, and we're all set, Jill. So very simple. We're already pretty far in with Jill. So we're getting a little bit nitpicky, but a lot of the major things have already cleared up. I expect we should be looking pretty good on our first re-exam, and maybe giving us a nice review on Google pretty soon, huh?
That's great. Oh, absolutely.
All right, so we're all set for today, Jill.
Thank you for everything.
You're welcome.